Have you ever looked at your CV and thought, I don't think I have enough recent clinical experience. Maybe I have nothing valuable to show. If that's you, then this video is for you. Okay, because today I'm going to prove to you that non-clinical experience, yes, the work you did outside the hospital can actually strengthen your practice ready assessment CV application. In fact, it can even help you to stand out. So I want to talk to you about one doctor. She's called Dr. Noor. And Dr. Noor reached out to me a couple of months ago. And she said, Dr. Boni, I've been out of direct patient care for almost 2 years. I've been volunteering, I've been teaching, and I've been helping in the community health programs, but I'm scared this doesn't count. And then I told her that experience might be the very thing that gets you noticed in your PRA application. Because, the PRA program isn't just looking for doctors who can treat patients. It's also looking for doctors who can communicate, who can collaborate, and who can contribute to the Canadian healthcare system. And that's exactly what non-clinical experience shows to whoever is reading your CV. So let's talk about what kinds of non-clinical experience actually strengthen your practice-ready assessment CV and how to present them the right way. The first non-clinical experience I want to talk about is teaching and mentorship. Doc, if you've taught medical students, nurses, or community health workers, you need to include it in your CV. Do it. Write it like this. Clinical tutor, University of Nairobi, January 2018 to December 2019. Then write something like this. Taught physical examination and case presentation skills to fourth-year medical students. Supervised and evaluated student clinical rotations. Because this tells reviewers that you can communicate complex medical information clearly to people, something that is highly valuable in the Canadian healthcare system, right? And I can say for a fact that Canada likes doctors who can also teach, because what can happen is that after your practice-ready assessment, if you go through it successfully and you are very good, they can send medical students your way for them to come and do some rotations. Or even some people who aspire to go to medical school, they can come and spend some days with you as you go through your clinical work. And that can be a huge, huge, huge boost to them and to yourself as well. So please, don't forget it. If you've ever taught, don't miss it, okay? And don't underestimate even informal teaching. So even if you trained junior doctors or give hospital presentations, that also counts in your CV. The second non-clinical experience I want you to include in your CV is if you've done any research or academic work. Because research shows discipline, critical thinking, evidence-based practice, which are all core Canadian medical practice values. So if you've ever been a research assistant, if you've ever been a co-author to any publication, or even part of data collection, please include it in your CV. So for example, you can write something like this: Research Assistant, Department of Public Health, University of Ghana, 2017 to 2018. Assisted in data collection and analysis for a study on maternal health outcomes. Next point, co-authored publication presented at national conference. What this shows is that you take initiative, you are analytical, you have the skills to work with a team. The third non-clinical experience you can involve in your CV is volunteer and community service. This one is gold. Gold, I mean real gold. Because especially if you've worked in underserved populations or in community health initiatives, this is good stuff. Because Canadian reviewers look and love seeing evidence of compassion and community involvement. So an example is volunteer physician community vaccination drive in Calgary in July 2022. Okay, so this doctor, even though the doctor is not practicing independently, is taking initiative to be part of volunteer physicians. That's powerful. For example, administered COVID-19 vaccines and provided health education to immigrant families. Wow. That, because it proves that you are engaged and you are adaptable, not waiting for opportunities, but you are rather creating the opportunities. So if a recruiter asks you, what do you bring to the table? You can then tell that recruiter that I am the table itself, right? Because I can create initiatives in my community. And if you did volunteering abroad or during relocation, that still counts on your CV. The fourth non-clinical thing you can add to your CV is administrative and leadership roles. What do I mean by this? Did you help to coordinate a clinic? Did you help to manage a health project or organize a team? That is leadership. And leadership always stands out in the Canadian healthcare system. You know, I've been and I've seen places where they are actually calling for leaders. And as an international medical graduate, with the wealth of experience you've had, you can easily become a good leader in the Canadian healthcare system if you apply yourself, right? So, for example, you can write something like this. I was a medical coordinator, rural health program, Pakistan, 2016 to 2017. Oversaw a team of 6 healthcare professionals providing mobile care services in underserved areas. Wow, that looks good. For example, you can also say, manage resource allocation and monthly reporting to regional health authorities. You know, even a small leadership role shows you are really matured as a physician, you are responsible, and you understand things at a system level, not just at the patient level, because systems have outcomes on patient care. Then another non-clinical thing you can include in your CV is your continuous professional development. So any online courses you've taken, any CMEs you've done, any webinars, any certifications, anything that proves you are still learning. So for example, me, after my MCQE1, I did the whole shebang, right? So I did MCQE1, I did MCCQE2, I did NAC OSCE, I did TDM. Then I went on to do the ATLS, ACLS. I did everything. I even did the alarm course. I went on to do the casted course. You know, all these, if they are not even a formal degree, it shows initiative. It does. And so you can state it something like this. Completed CME series on chronic disease management, University of Toronto continuing education, March 2023. Simple. Because reviewers want to see that your mind is still active in medicine, even if your hands have not been active recently, because you moved, maybe because you had a baby, you were recently married, you know, there was a family emergency, but you still are learning. You still are learning. You still are learning, right? Now, the sixth non-clinical thing you can add to your CV is administrative or office support in Canadian clinics. So maybe you worked as a medical office assistant, you did charting, you did billing, you did scheduling. That's actually valuable because it proves that you are familiar with the Canadian healthcare system, the electronic medical records, the billing codes, patient flow. So you can include something like this: medical office assistant, Wellness Medical Clinic, Vancouver, 2022. Right? What did you do? I scheduled appointments, maintained EMR documentation, and assisted in patient intake. Because this shows you've already interacted with the Canadian healthcare system. And something reviewers really value is what we call the Canadian experience. And the Canadian experience comes in all these facets. So now let's talk about how to list your non-clinical experience on your CV. What you need to do is to create a title and a section with this title: non-clinical work experience or other professional activities. Then list each position in reverse chronological order, with the newest first. Include the title, include the institution, include the location, include the start and end date, and then 2 to 3 bullet points which describe that contribution you made. What you also need to do is to keep it really short, to keep it factual, and to keep it relevant. And always remember, your goal is not necessarily to fill space. Rather, your goal is to provide continuity, engagement, and professional growth. Right? So when Dr. Noor rebuilt her CV, we added every non-clinical thing she had done: her teaching, her volunteering, her CME work. And when she submitted it to PRA Alberta, boom, she got shortlisted. So the feedback she received was very simple. we appreciate the diversity of your professional experience. So you see, she's not coming across as just somebody who sees patients, right? She has a whole repertoire of experience which she can bring to the Canadian healthcare system and help with patient care and system management. Then when she told me, I thought my non-clinical years were my weakness. It turns out they were rather my strength. So my friend, doctor, here's what I want you to take away from this. Your PRA reviewers don't just want to see where you've worked. They want to see who you've become. Think about it. They don't want to just see where you've worked. They want to see who you have become. Because your teaching shows communication. Your volunteering will show compassion. Your leadership will show initiative. And your continuous learning will show dedication. And together, those qualities will tell a wonderful story, not of a doctor who stopped working, but of a doctor who never stopped growing. So at MedCognito, we will help you to turn that journey, whether it is clinical or non-clinical, into a powerful story that gets noticed in Canada. So if you'd like us to review your CV before you submit and before you apply, just type in the comment section, get in touch. Let's help you to turn your non-clinical experience into something which will boost your CV. See you on the other side of success.